In this presentation, we're looking at the GPS Smart Sole and its impact to healthcare. In this presentation, we'll be looking at the GPS Smart Sole and its impact on healthcare as a whole. In looking at this product, we will determine the need for this product in healthcare, as well as determining what the product is and how it can be used. It will also be important to review the threat that this product may have on existing healthcare organizations, as well as forecasting the partnership with the product and healthcare organizations and improving overall patient care. By the end of this presentation, we will have a clear understanding of the product and its impact, and the impact that it will have on overall patient care. Who needs the GPS Smart Sole and the impact it can have? In looking at how a product will benefit healthcare, it is important to look at the impact it will have on a specific patient population. The GPS Smart Sole is a GPS tracking device that can assist in improving the overall safety of patients with Alzheimer's or dementia. In America alone, 6 million Americans have been diagnosed with Alzheimer's disease or dementia. Of these individuals, 60% of them will become lost during the course of their disease process. This is due to the patient's tendency to wander as it relates to their cognitive impairment. Not only will this impact the patients diagnosed with the disease process, but it will also benefit the caregivers providing care and oversight to these patients. In America, there are 15 million people who are helping or providing care to someone who has Alzheimer's disease. In the nursing home setting, the prevalence of wandering behavior in the nursing home was noted to be 11.6% on traditional units and 52.71% on Alzheimer's units, which again forecasts the need for the GPS Smart Sole. Potential threats to existing healthcare organizations. In looking at the potential threats of this type of technology could have on an institution, it is important to look at the financial impact on existing healthcare organizations. This could potentially negatively impact facilities that market having a locked unit to ensure the safety of wandering Alzheimer's dementia patients because of other facilities without these units being able to take these type of patients with the addition of this technology. Another potential threat would be to determine the staff needed to monitor the application of the tracking system in order for this GPS device to be effective in ensuring the safety of wandering residents. This could have a significant financial impact in the organization, and they may not be able to take the patient population due to the lack of staff and resources. Lastly, this may impact existing healthcare organizations in that they will need to find funds to pay for the equipment and pay the monthly fees in order to secure the GPS tracking devices. If they can't find these fees, they may not be able to take Alzheimer's dementia patients that wander. This could put them at a disadvantage in their marketplace, being inhibited from taking a specific patient population. Forecasting the partnership between the GPS Smart Sole and healthcare organizations. In utilizing the GPS Smart Sole, there would be an opportunity to foster a partnership between the manufacturer and healthcare organizations. One of the ways in which the technology could benefit healthcare organizations is that it will allow healthcare organizations to ensure that they can manage the patient safety of Alzheimer's and dementia patients that either have a history of wandering or potential to wander. Another way in which this could benefit the healthcare organization is that often when a patient has a history of wandering or attempts to wander, the hospital will have to place a one-on-one sitter in the room to ensure their safety. This technology would either allow for the staff member not being necessary or having the staff member perform necessary duties and provide overall patient care in the hospital. Lastly, utilization of this type of technology will allow for skilled nursing facilities to market their ability to safely manage the care and services of residents with dementia and or Alzheimer's. This will also improve and enhance the patient's independence with these types of diagnoses, and that they won't be restricted to certain areas, but will have freedom. This will enhance the patient experience and give them better quality of life. They will be able to market that they can safely manage these patients, putting the minds of families at ease that they won't wander from the facility. Caregivers often struggle with placing their loved ones in a nursing home or healthcare setting, but it has been proven that caregivers are reassured with the organization's ability to meet the needs of their loved ones, including ensuring their overall safety. In conclusion, The GPS Smart Soul will allow for a new era of patient care for those diagnosed with Alzheimer's dementia and having the potential to wander. There's an ever-growing population of Alzheimer's dementia patients who have the possibility of wandering and placing themselves in danger's way. This product allows for healthcare organizations to safeguard this type of population. The GPS Smart Soul may have a potential threat to current healthcare organizations in that it may take away business from organizations that have marketed a secured Alzheimer's dementia unit to prevent these patients from wandering. This product requires monitoring of the GPS tracking device in order to monitor where the patient is going, which may result in the healthcare organization to hire more staff. Lastly, this technology could pose a potential threat to whether or not the organization can afford the monthly service costs in operating the GPS Smart Soul. While these threats are present, there is also an opportunity for potential partnership between the GPS Smart Soul and healthcare organizations. Some of these opportunities for partnership include the following. The GPS Smart Soul will allow facilities to market that they are able to increase the independence of the Alzheimer's dementia patient that wanders and market that they will be able to support the safety of these residents. Another opportunity for partnership opportunity for the healthcare organization with using the GPS Smart Soul is decreasing the cost of having to hire one-on-one sitters when there is a fear of a resident wandering off the unit, thereby increasing the profits of the organization while increasing patient safety. Please refer to this reference page for references used in this presentation. That concludes the presentation on the GPS Smart Soul and the impact that it will have on healthcare organizations. Thank you for your time.